So again, today we're going to be demystifying prep. I will go through and debunk some of those myths and provide, some information. Also, I just want you all to know that Whitman-Walker is always here to answer your questions about prep. And as you can see, I pinned the number at the bottom, which is, 202-939-7690. But you can also call us for any medical and preventative care information at 202-797-4439. So let's get started. So today, again, we are demystifying prep. So I'll start by introducing myself. I am David Wilson. My preferred pronouns is are, he, him, his, and I am a social media with Whitman-Walker. So I've been doing this role for about 7 months now. It's been amazing. I really love my Whitman-Walker team. Especially during a time like now when you need a lot of the resources that we offer. And so during the last few months, the Whitman-Walker Community Health Department has expanded its outreach efforts to target social media platforms, which is why I'm here. We tend to cover various topics about HIV, STI, sexual health practices, as well as access to care, social determinants of health, and general public health intervention. So that's what we're here for. Our next series of outreach sessions are to focus on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health during this time. So our community team is here, and we are here to support you. So just know that you can always reach out to us, and we'll be there. I see you have a few people join us, so I'm going to do my wave, say my hellos. Hi, everybody. So again, we're always available for you. You can call us at the number that's pinned above the comments, or you can just reach out to the number that you see on the screen. So, I'll be talking for about like 20, 30 minutes about prep, some of my personal experiences being on prep, as well as, general knowledge about the medication. And so if you have any specific questions, you can feel free to drop them in the comments and we'll answer them as we go along. So first up, what is PrEP? So PrEP stands for pre-exposure prophylaxis. And PrEP is a HIV prevention method that helps reduce anyone's chances of becoming HIV positive. So there are currently 2 FDA-approved drugs for PrEP. The first one is the well-known drug that's been around for some time now, and that is called Truvada. And there's another that is more new called Descovy. So those are the 2 options, FDA-approved options for PrEP as we stand today. I actually am on PrEP, so I, take Truvada. I haven't made a decision to switch over just because of, I've had that conversation with my primary care provider, and she and I agreed that we didn't think it was necessary. So you don't have to switch to Descovy if you're on Truvada. That's totally up to you. So what is the difference between PrEP and PEP? I know those are like 2 interchangeable, or they're not interchangeable, but people have mistakenly done them, use them interchangeably. So what's the difference? PrEP stands for pre-exposure prophylaxis, as I mentioned. Whereas PEP stands for post-exposure, which is post-exposure. So what does that mean? So PEP is a 28-day course of antiretroviral medications that you take after like a possible HIV exposure. So if you're taking PEP, you have to start that regimen. So within 72 hours. So if you think that you've been exposed, it's best to start that regimen, the 28-day course of the medication, 72 hours after your possible exposure. PEP is used in emergency situations. So if someone thinks they've been exposed to HIV through sex or needle sharing or any other medium, then they could use PEP to reduce their chances of becoming HIV positive. So PEP is kind of similar to Plan B. When you think about it, you take plan B after you've possibly, you know, after a possible exposure to semen and you could possibly get pregnant. So you would take plan B. PEP is kind of the same concept. You take it after your exposure. PrEP, you know, is pre-exposure, so you take it before the exposure and it helps prevent you. So that's the prevented someone from becoming HIV positive. So those are the differences between the two. And we got my Whitman-Walker team following up on some of that. So there are a lot of myths about PrEP. And, you know, I want to make sure that I cover some of those so that we are not sharing misinformation about, you know, this medication. So I've heard, you know, people say, you know, PrEP doesn't treat HIV. And yeah, no, let's talk about that. So the medication used for PrEP, it can be part of an HIV treatment regimen, but PrEP, you cannot treat HIV alone, right? So it can be part of someone's HIV regimen. However, using it alone, we don't consider that to be a treatment for HIV. PrEP itself is a preventative or prevention method for folks who are HIV negative and who have a greater chance of becoming HIV positive. So, yeah, that's that on that. So PrEP can be up to 99% effective at stopping HIV through sexual transmission if the pill is taken every day. So that's a key fact. If the pill is taken every day, it can be 99% effective. You know, I take my pill every day, so that is the effective efficacy rate that I am expecting since I take it every day. So what are some of the PrEP efficacy or, you know, risk reduction percentages? So we'll talk a little bit about that. So like I said, if you take it 7 days a week, every day, then it's 99% effective. But if PrEP is not taken every day as directed, then it becomes less effective, right? So for a person who, you know, has sex, you know, rectal sex, studies have shown that, you know, if you take it 7 days a week, that's 99% effective. So there is still more studies needed to determine the exact protection for vaginal or cervical tissue transmission. So I don't have those numbers for you. However, through anal intercourse, if you're taking PrEP 7 days a week, you can feel comfortable knowing that it's 99% effective. Some other things, you know, that are constantly mystified is, you know, the side effects of taking PrEP. Most people actually report no side effects. When I started, you know, PrEP years ago, I didn't have any side effects. So I'm one of those people that did not experience any side effects. However, about 10% of people do report side effects. And those side effects tend to be mild, you know, and that tends to happen within the first week or two of them taking the pill. And so some of those side effects could include nausea, diarrhea, headaches. I've even heard some people experience, you know, bloating and things like that. But these type of symptoms generally are reported to go away quickly after repeatedly taking the medication. There are a small number of people who take PrEP, and those people have experienced changes in their kidney function. So their kidney function and their bone density. So these side effects, again, they're not common, but for PrEP to work and for you to actually be on a good PrEP regimen, you must follow up with your doctor every 3 months. So you go to your doctor every 3 months, and during that appointment, you take lab work. From that lab work, you get a metabolic panel. In that metabolic panel, it shows a status of your kidney function, which is extremely important. So if any changes were to occur to your, you know, panel, if it falls out of range and your doctor or medical provider becomes concerned with that, appropriate actions can be taken. And that could actually be, you know, coming off of PrEP if need be. Um, All right. Looks like I'm getting some questions. All right. All right. Some very interesting questions going on in the comments, but yeah. So if if you have kidney, issues on the medication, you can definitely stop, and your kidney function should return to normal. And so how do you get started on prep? I am definitely a prep advocate. Clearly, I'm talking about it. I take prep. It has actually, I think added positive things to my life and my sexual life. And so I, am a person who would suggest it, right? So how do you get started on prep? So prep generally starts with a conversation with your medical provider. That could be your primary care provider, your doctor, a medical team member, or an HIV test counselor. Um, Through that conversation, you can determine if prep is good for you. If you think you can stick to the regimen, if you are good at, adhering to daily medications, then it sounds like you would be a good person, for prep. That's really the key. Like, are you able to take this pill as frequent as you need to for it to have its maximum effectiveness? So once that you decide that you would like to begin prep, you can schedule an appointment with your medical provider. Also, if Whitman-Walker is your medical provider, you can do that there. If it's not your medical provider, you can still reach out to us. We can possibly become your medical provider. Just give us a call at that 202-797-4439 number, or the other number pinned there at 202-939-7690, which is pinned above the comment. So, again, prep, you reach your maximum protection level after 7 days of daily use. And that is for anal intercourse, right? And so for vaginal sex, or I want to make sure I'm saying this right, for vaginal sex or injection drug use, the maximum efficacy is 21 days of daily use. So for those who are, for vaginal intercourse, remember that you'll need to take your pill every day for 21 days for it to be its maximum effectiveness. For anal intercourse, that is reduced to 7 days daily. So every day for 7 days. Yeah. All right. So what's the cost? That is always a big question I get when people ask me, oh, so you take prep, what's your cost? And I've been lucky enough that I have not ever had to pay for the medication out of my pocket, with a combination of resources that I will talk a little bit about. So lucky me, I haven't had to pay. I know that not everyone, will be as lucky. However, there are a lot of resources available. So don't let cost be a limiting factor if you are interested in prep. So the cost of prep does vary depending on, your insurance status and what your insurance plan covers or doesn't cover, right? If someone is insured, most insurance plans do cover prep, and I'm talking about both public and private insurance plans. So most actually do cover prep. Mine does, and most people that I know actually does also. So, but with your insurance plan, you may have monthly out-of-pocket costs. There could be a copay, or you might need to meet a deductible before they pay for the medication. That is a case-by-case, person-by-person basis, insurance by insurance basis, right? So, you can either, if you're concerned about that, you can always call us at Whitman-Walker, and we actually have a team at our insurance helpline, and that number is 202-745-6151. Our team at the insurance helpline, they can help you, figure out, what your situation is with your insurance. They could also help you navigate public benefits if you lack insurance. So the team actually is very good with that. I've utilized them myself when I started prep. So I'll give you a quick example. So when I started prep, I had a high deductible plan on my insurance for my insurance, medical insurance. And that was a personal choice of mine because I didn't think I would get sick. So I was like, a high deductible plan will probably work for me. I didn't think about, when I started prep that, I would have to pay my high deductible before I could, get them to pay for the insurance. So the insurance navigator at Whitman-Walker actually helped me get resources to cover my deductible. And I'll talk a little bit about those. So again, the insurance navigation team, they can help you seek options to enroll in an insurance plan. They can also contact, or you can also contact your member service of your insurance plan to determine what your specific out-of-pocket costs are. Or you can call us and we can help you with that as well. So I will say, like, the insurance navigator was extremely helpful, and they were extremely helpful because they helped me discover a supplemental program that Gilead has. So Gilead has an assistance program, and Gilead is the manufacturer of Truvada and Descovy, which are the names of the medications for PrEP, right? So Gilead has an assistance program, and that program is for individuals who, need help paying for PrEP. And so the way it works is that they can either cover your copay so that you don't have to pay your copay, or will cover your deductible. So I've actually had both experiences happen. So I've had them cover my copays when I had a copay plan, and I've also had it where they cover my deductible, which was pretty significant and pretty good. So it made my life a lot easier. So those are a little bit about resources, about costs if you're interested in taking PrEP. I do want to talk about some of, the questions, we've gathered over, the years, and some of the things I've heard over the years of taking PrEP. I've, got the question of, do I have to take the pill for the rest of my life? The short answer to that is no. The decision to take or not take PrEP is a personal choice. So if you're on PrEP and you're considering stopping, like, you can do that. I definitely encourage you to talk to your doctor or your medical provider about what that process should look like for you. But you definitely have the option to stop taking PrEP if that's what you want to do. You do not have to take it for the rest of your life. Some people, I've heard where some people may want to stop taking PrEP. Either they got into a long-term monogamous relationship with an HIV negative partner, and they felt comfortable enough that they didn't need to remain on PrEP. Or they were dating a, HIV, or a person who was living with HIV, and this person had an undetectable viral load. So if you are in one of those scenarios and you are interested in stopping your PrEP regimen, that is your choice. I cannot make that decision for you. That's definitely a personal choice. But I will say this, that, if a person is, living with HIV and they're taking their antiretroviral treatment as directed by their doctor and have, an undetectable, viral load, then, that should be good. That should be good. So I'll talk a little bit more about that later, but, if you are in that scenario, yeah, like, that's definitely a possibility. Also, if a person is, engaging in less sexual activity overall, they may consider stopping PrEP. So if you're not having sex as much, then maybe you could, stop PrEP. Now, again, that's a personal choice. It's really up to your individual desires. So can I stop taking PrEP because I'm not sexually active? Yep. So John, I just answered that question. So if you are not sexually active, yes, you can stop taking PrEP. What you should do is let your doctor know that you are planning to stop taking PrEP. They will probably encourage you to be tested and all that. Also, like, if you want to start again, let your doctor know that you want to start again, and you can go through the phase and start. Just remember that its efficacy is not at 99.9% until, say, 7 days consecutive daily consumption. So you have to take the pill for 7 days for it to have its 99.9% efficacy. So just remember that if you decide to stop and then start back. But yes, you can totally stop and start. So, another question is, what happens if I don't take the pill every day? So if you don't take the pill every day, the short answer to that question is that it's not as effective as it would be if you took it daily. So that really is dependent on the number of days that a person has not taken the pill. So the number of days that you have not taken it, the level of protection decreases. It's, pretty simple as that. So I don't have actual percentages on a day-by-day basis, but its efficacy is reduced each day you miss. So yeah, I can sum it up in that way. But just in general, the more consecutive days you miss, the lower level it becomes. So just remember that 7 consecutive days, 99.9% efficacy. And back to the question about, do you have to take the pill if your partner is undetectable? That is an extremely, so good question, John. Do you have to take the pill as a total top? So, look, taking PrEP is definitely your decision. So I'm not going to say, yes, you have to take the pill. That is your decision. It's really up to your personal needs. I think the key to know that a person on PrEP, if you are on PrEP and you've taken your pill 7 days, and you're having anal intercourse, then you're 99%. The pill is 99% effective. We can get into all type of calculations of, about like receptive versus, non-receptive sex. But I think the key there is just to know that, if someone is taking PrEP for 7 days, it's 99% effective. But that is a good question, John. All right, so back to the question about being, taking the pill if your partner is undetectable. If someone is HIV positive and have an undetectable viral load, that means that that person essentially has no risk of transmitting HIV through sex. So undetectable, generally means untransmittable. So keep that in mind. So again, if you want to stop PrEP because you're in a relationship with someone who has an undetectable viral load, that is your choice. But do know that it is extremely unlikely that a person who's undetectable will transmit AIDS. The risk is so low. It's like almost none at all. Yes. Any questions? No. All right. So, again, I want to just point out that, taking PrEP, not taking PrEP, that is completely up to you. It's really up to whether or not you choose to trust your sexual partner, right? And that's what it really boils down to. And it depends on your sexual practices, your sexual needs, and your long-term or your relationship goals, I would say. So it's not really a yes or no question on should a person take PrEP. I can't say that for anybody. It's really a personal need. Only you know your sexual habits. I wouldn't know that. I'm sorry, but I definitely encourage you to have this conversation with your medical provider. If you are interested in taking PrEP, that would be the best starting point. And then they can help you navigate, resources as well as, figure out if PrEP is right for you. I would definitely say this. PrEP is an excellent option to prevent HIV transmission through sex, So I will leave you all with that. I take it. I haven't had any side effects. I think it has been, a good experience. Again, I find it relevant and good for my sexual needs and my sexual habits. And so I've continued to take it. I've actually been on PrEP now for maybe 5 or 6 years. So I've been on it for a while. And so, yeah, if it is right for you, go for it. And just be sure to have that conversation with your medical provider. I do want to bring us back to the attention at the bottom of the screen. If you have more questions about PrEP, you can call us again at 202-939 7690. If you have any other, medical concerns, or you want to get connected for medical care, preventative care, or to access COVID-19 resources, you can call us at 202-797-4439. I also want to encourage you all to follow us on Instagram at Whitman-Walker. Follow me too, sir_Dave_. But also follow Whitman-Walker at Whitman-Walker on Facebook and on, what's the other one? Twitter. And that's all I have for today. I mean, I appreciate all the engagement, the questions. So John is asking a question. That's a personal question, John, but I don't mind answering it. Has my sex life increased while on PrEP? No, I think it stayed the same. So a little story. I didn't plan on sharing this, but I'll share because I think it's interesting. I decided to get on PrEP, after I was dating somebody. So I was in a monogamous relationship, and I decided to get on PrEP because I wanted to remove condoms from our relationship. And so since I was making the decision to remove condoms from our relationship, it made me more comfortable doing that, being on PrEP. My sexual partners didn't increase. I had one partner. It was my partner at the time. But to answer your question, no, like my sexual, I don't think it increased. It probably stayed the same, if not reduced. But that's a good question. That's another myth I've heard. I think it's really dependent on the person. My sex life pretty much stayed the same. I was in a monogamous relationship when I decided to take PrEP. And so I don't think that has anything to do with it. Yeah. Great question, John. All right. Any other questions? If not, I mean, I appreciate you all and your time. Again, we know it is super, super crazy right now with, COVID-19 and everything else that's going on. So, continue to demonstrate, whatever you are passionate about, get out there with us. I'm going to say Black Lives Matter. And I want you all out on the front lines with us. I appreciate your time again. Stay safe, stay healthy. Whitman-Walker is here as a resource. Follow us on Instagram, Twitter, and Facebook at Whitman-Walker. And feel free to call us at the number posted here. So thank you for your time, and adios.